Hi, I'm Ariana Conacher, and this is my capstone presentation. So, what was my capstone about? My capstone project was about music and its effects on different mental conditions. This includes disorders, illnesses, and diseases. I separated each mental condition into two categories: what it is and what its symptoms are, and how music affects it and how it can help. So, what is ADHD? ADHD, also known as Attention Deficit Hyperactivity Disorder, is a common neurodevelopmental disorder. The criteria for an individual to be diagnosed with ADHD are inattention, hyperactivity, and impulsivity. Neurologically, ADHD is the deficiency of a neurotransmitter called norepinephrine. Norepinephrine plays a role in your mood and ability to concentrate. Due to the deficiency of norepinephrine, there is an impairment in the frontal cortex, limbic system, basal ganglia, and reticular activating system. The frontal cortex controls attention, executive functions, and organization. The limbic system controls our emotions and attention. Deficiency in the basal ganglia causes the brain's intercommunication of information to essentially short circuit, causing inattention and impulsivity. The reticular activating system, or RAS, or RAS, is the major relay system among the many pathways that enter and leave the brain. A deficiency in this area leads to inattention, impulsivity, or hyperactivity. ADHD is most commonly found in young people, often diagnosed in childhood. So, how does music affect ADHD and how can it help? ADHD means that your brain is moving at a very fast pace. Being so physically and mentally energized leads to a lack or inability to focus. This means that structure is extremely important to the ADHD mind. Music provides that structure. Every song has a clear beginning, middle, and end, making it predictable. The beats and rhythm also have specific structures. This can help refocus the mind as well as encourage better mental and even physical organization. So, how does music affect ADHD and how can it help? ADHD means that your brain is moving at a very fast pace. Being so physically and mentally energized leads to a lack or inability to focus. This means that structure is extremely important to the ADHD mind. Music provides that structure. Every song has a clear beginning, middle, and end, making it predictable. The beats and rhythm also have specific structures. This can help refocus the mind as well as encourage better mental and even physical organization. Music also activates both sides of your brain. The activation of both sides essentially works out the muscles in your brain. This means that music is making your brain as a whole work more efficiently. This means music is making your brain as a whole work way more efficiently and possibly even strengthen the connection between the two halves of your brain. This leads to an increase in motivation and attention. The next mental condition I'm going to be talking about is Alzheimer's/dementia. So, dementia and Alzheimer's are very mixed up and are commonly mistaken for each other. I'm here to clarify that. Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia. Alzheimer's is a specific disease, and dementia is not. The majority of people with dementia are 65 years old or older. However, it isn't unheard of people who are younger to also contract Alzheimer's. There are approximately 200,000 Americans under the age of 65 who have younger onset Alzheimer's disease. Alzheimer's is a very progressive disease, where dementia symptoms gradually worsen over a number of years. In its early stages, memory loss is fairly mild. However, with late-stage Alzheimer's, individuals lose the ability to carry out and have regular conversations and respond to their environment. Alzheimer's is the sixth leading cause of death in the United States, and it is estimated that there are approximately 44 million people worldwide living with Alzheimer's disease. So, how does music affect Alzheimer's/dementia, and how can it help? Music is very helpful when it comes to helping those with Alzheimer's/dementia. Music processing enhances a general level of activation, possibly promoting motor activity and even memory recall. Another big reason that it is so helpful is because in some cases the mental processes relating to music possibly are the last to deteriorate in the disease process. This idea can be related to reminiscence therapy, in which tasks such as singing, verbalizing, and moving are performed. Yet another benefit of music is that singing familiar or old songs tend to act as memory triggers. This means that music is encouraging feelings of connectedness to past events and emotions associated with them, and that is something Alzheimer's patients struggle with severely. Music therapy also tends to work better on musicians who suffer with Alzheimer's. This is because musicians have muscle memory when it comes to their instruments and memory of auditory material. Music is also theorized to help with language retention. An example to back up this idea is a study by Riquet, Bard, and Peretz, in which they investigated the production of sung and spoken utterances in aphasics. When they sang or spoke along with an auditory model, chorale singing or speaking, while learning novel songs, they repeated and recalled more words when singing than when speaking. These results suggest that chorale singing is more effective than chorale speaking, because chorale singing may engage more than one auditory vocal interface. There are also several studies that suggest that listening to music on its own may have direct effects on emotional response, independent of social interaction. Music therapy's power for aiding in healing dementia lies in a number of sources: superior retention, attention, arousal. Music therapy's power for aiding in healing dementia lies in a number of sources: superior retention, attention, arousal, bypassing or triggering failing capacities, and underlying physiologically, neurologically, or socially driven emotional effect. So, what is anxiety? Well, the most commonly referred to form of anxiety disorders is GAD, or Generalized Anxiety Disorder. GAD is defined as a persistent and excessive worry about a number of different things. GAD is the most common of the anxiety disorders, affecting 6.8 million adults, or 3.1% of the population in any given year. GAD is when a person finds it difficult or impossible to control worry for at least 6 months and has 3 or more symptoms. These symptoms include the following: feeling nervous, irritable, or on edge, having a sense of impending danger, panic or doom, having trouble sleeping, hyperventilation, sweating and/or trembling, having an increased heart rate, feeling weak or tired, difficulty concentrating, and even experiencing gastrointestinal problems. Although anxiety is common for one to experience in their lifetime, people with GAD often suffer from rumination. Rumination means that they worry more than they should about actual events, or they expect the worst to happen even when there is no reason for their GAD can be a seriously debilitating disorder for many people, to the point where even the thought of getting through the day can produce anxiety. This disorder happens gradually. However, the risk for developing it is highest during childhood and middle age. Although the exact cause of GAD is unknown, there is evidence that biological factors, family background, and life experiences play a role in development. So, how does music affect anxiety, and how can it help? Well, the most common trigger for anxiety is stress. Therefore, a reduction in the amount of stress a person is experiencing, the less anxiety they will experience. Stress and anxiety both interfere with the functionality of the hypothalamic pituitary adrenal axis, and both secrete the stress hormone cortisol. Music signals the release of dopamine, raises oxytocin levels, and reduces cortisol levels. This makes it a great tool to reduce depression and anxiety, mental health issues that are both caused by high levels of cortisol and low levels of dopamine. An example of this is a current study that was conducted at Salisbury University in 2017, which included 105 participants. These participants gave informed consent to be tested on to see if musical intervention after a stressful task would reduce their stress. The musical intervention included 2 groups participating in musical behaviors after a stressful task and a control group. One group listened to a predetermined 5-minute musical composition, and one group improvised on a xylophone for 5 minutes. This study found that music, both listening and playing freely, has stress-reducing effects. Research has also proven that music can prevent spikes in heart rate and blood pressure that stem from anxiety. Not only that, but creating music can also mediate changes in heart rate. Yet another way music helps with anxiety is shown in a systematic review performed in 2008 by Nielsen that looked at the effectiveness of pre, post, and intraoperative musical intervention. This review included 42 studies on anxiety and/or pain of patients. In the review, it was reported that the musical intervention significantly reduced anxiety scores in 50% of studies. It was also shown that the use of sedative drugs was significantly less for patients in the music group in comparison to the control group who didn't listen to music. It was also shown in the same review that music tempo, whether it was lyrical or not, the types of instruments used, and the volume has effects on how effective it is on helping patients with anxiety. The tempo of the music was the most important factor out of these in the studies. The use of slow and flowing music with 60 to 80 beats per minute appeared to have the most positive outcomes on relaxation and pain relief. Nielsen also found that the recommended type of music was non-lyrical, consisting of low tones with strings and minimal brass and percussion. They also found that a volume level of 60 decibel was the most ideal. During this study, there were several papers written advocating for patients to choose their own music. However, no significant difference was found between patients who selected the type of music they wanted to listen to and those who didn't choose at all. While doing research into this, I decided to look up if I could find a piece of music that exemplifies what they were looking for. And I did. An example of this is A Place to Call Home by Peter Cavallo. According to the Cleveland Clinic, dissociative identity disorder, formerly known as multiple personality disorder, is when people develop one or more alternate personalities that function with or without the awareness of the person's usual personality. These personalities or identities are all unique. Each identity may have a unique name, personal history, and characteristics, including obvious differences in voice, gender, mannerisms, and even such physical qualities as the need for eyeglasses. Many people have a skewed idea of what DID actually is due to negative coverage by the media, such as the movie Switch. A great way to understand DID and how it works was defined by YouTuber Dissociated, who suffers from DID themselves.
Like that, you could imagine the original personality as a bowl. If you drop a bowl on the floor and it shatters into lots and lots of different tiny fragments, how do you pick which one of those fragments is the real original piece?
DID develops typically during childhood as a way to cope with trauma. It is the brain trying to protect the child. The disorder most often forms in children who have been subjected to long-term physical, sexual, or emotional abuse, a home life that's frightening, and even war or natural disasters. This happens because when you are a child, you are still forming a personality. Therefore, you are able to step outside of yourself, unlike adults, aka dissociate. There are many things that can trigger switches between identities. Stress, memories, strong emotions, and sensory inputs can all trigger a switch. Studies indicate that DID affects about 1% of the population. Although that seems low, that is still at least 77,781,864 people. So, how does music affect DID and how can it help? Unfortunately, there is very little information on music/music therapy and how it can help DID. Many people with DID have maladaptive behaviors. Music therapy is able to provide alternatives to these maladaptive behaviors. Patients can be taught to use everything from songwriting to making parodies of songs, to instrumental playing, to song listening, and even lyric analysis to assist in their coping process. Music can also trigger switches between identities as it is a sensory input. Finally, let's talk about our last mental disorder. What is PTSD? Post-traumatic stress disorder, or PTSD, is a mental health condition that's triggered by a terrifying event, or TE. This can occur through either experiencing it or witnessing it. PTSD is also characterized by an inability to recover from a reaction of stress by 1 month following exposure to a traumatic event. PTSD symptoms are also grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and arousal symptoms. The intensity of these symptoms can vary vastly. Intrusive memories include flashbacks, nightmares about the TE, recurrent distressing memories of the TE, and severe emotional distress/physical reactions to something that reminds you of the TE. Symptoms of avoidance may include avoiding thinking or talking about TE, and avoiding people, places, or activities that remind you of the TE. Common symptoms of negative changes in thinking and mood are negative thoughts about yourself and others, memory problems, including but not limited to not remembering important aspects of the TE, feeling emotionally numb, and feeling detachment from friends and family. Arousal symptoms or changes in physical and emotional reactions include self-destructive behavior, being constantly on guard, guilt and shame, anger/irritability, outbursts, and trouble sleeping and concentrating. For children 6 years old or younger, they also may reenact parts of the trauma through play. In a study of nearly 6,000 U.S. citizens, 60% of men and 51% of women experience at least one traumatic event in their lifetime. However, only 8% experienced PTSD. So, how does music affect PTSD? Music is evidence to reduce emotional distress, foster social connectedness, and improve overall well-being. Music can also help ground someone in the present moment when faced with an intrusive or distressing reminder/trigger. Music has also been shown to reduce cortisol levels and amount of stress, increasing the release of dopamine and fostering connectedness to one's community. These are things that people affected with PTSD struggle with. There's also significant evidence that damaged neurons can be possibly healed or stimulated by music. So, what has this capstone presentation meant to me? This project has actually inspired me a lot towards my career path and has helped me a lot as a person. Personally, I suffer from ADHD and anxiety. Listening to the music that I found before actually really helps me when I'm having a strong, anxious reaction to something. It has also helped me realize how much the research into music and mental disorders is lacking. It has inspired me to further this research, because all I want to do is help people, and I can help them by finding out this information so that they can cope with what they're dealing with. It's also given me a better look into mental disorders I knew very little about. I'd like to give a special thanks to Dissociated. I emailed Dissociated and asked them for permission to use their clip in my video, and they said yes. If you're interested in learning more about DID, I highly recommend their YouTube channel, Dissociated. This has been my capstone presentation. Thank you very much.